name is Melanie Jackson. I'm a nurse practitioner student at South College. Can you tell me why you're here today?
I'm here to get an assessment.
That's correct. We're going to be doing a head-to-toe assessment today. Okay, first I'm going to wash my hands. We've closed the door when we came in to make sure we have some privacy. I'm going to wash my hands first. If I could get you just to remove your shirt so that we can complete this assessment today, okay? Prior to coming into the room, we did vital signs on the patient. His temperature was 98.2. His heart rate was 63. His respiratory rate was 16. His blood pressure was 115/63. He was sitting 98% on room air. He is 6 foot tall, 165 pounds. His BMI is 22.4, which is a healthy BMI. He's well nourished. He's well groomed. His mood is appropriate. His hearing and speech have been intact with the questions that I have asked him. Can you tell me your name?
Cole Jackson.
And can you tell me what year it is?
2025.
And where are we at right now?
The doctor's office.
Okay. He is alert and oriented ×3. Okay, first what I'm going to do is I'm just going to check your skin all over your body just to make sure that there's nothing, no lesions, no discolorations that we need to check or to test for, okay? So I'm just going to look at your face, your chest, your abdomen, your arms, your legs. Okay, I'm going to get you to stand. The backs of the legs. Okay, you can sit down. There's no lesions. Hair distribution is normal. There are no discoloration, no areas that need to be addressed. Okay, next what I'm going to do is I'm going to just inspect your face and your skull, just looking at it. The face is symmetrical. The skull seems to be symmetrical. There's no involuntary movements. There's no lesions. The skull does not appear to have any deformities. Next, I'm going to check your hair and your scalp. The hair is brown. It is coarse. It is evenly distributed. There are no evidence of loss or thinning. The scalp, there are no lesions, no areas of redness. Does not appear to be any infestations. The skull, no deformities noted. Next, we're going to check your cranial nerves 7 and 12. What I want you to do for me is smile. I want you to clench your teeth. I want you to clench your eyes. I want you to wrinkle your forehead up. I want you to stick your tongue out, side to side, and I want you to puff out your cheeks. Next, we're going to check your temporal pulses. Just feel here. Temporal pulses are positive and they're 3+. Next, I'm going to check your sinuses. We're going to do your frontal and your maxillary sinuses, okay? So, any tenderness, any pain?
No.
Okay. Any tenderness, any pain?
No.
No tenderness noted. Next, we're going to do a sensitivity and a pain test. So basically what I'm going to do is take a Q-tip, I'm going to rub it over your face, and I want you to tell me when you feel it. And then I'm going to take the back of the Q-tip and kind of do just some little sticks to see when you can feel that. Alright, tell me when you feel it.
I feel it. I feel it. I feel it. I feel it. I feel it. I feel it. I feel it.
Alright, now we're going to do the other end of the Q-tip.
I feel it. 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 I feel it.
Okay, very good. All intact. Next, I'm going to check all your lymph nodes of the head and the face, and then we'll also move down into the neck and the chest area. Okay? Any tenderness in any of these areas?
No.
You let me know if you feel any tenderness. Any tenderness or anything noted?
No.
Okay. Next, we're going to move on to your eyes. The first thing that we're going to do is the visual field with confrontation. So what I'm going to have you do is cover one of your eyes with your hand. I'm going to cover the same eye, and I'm going to come in with my fingers, and I want you to tell me when you see the fingers, okay?
No. No. No.
Okay. Now, you keep that same eye.
No. No. No.
Okay. All right, now I want you to switch eyes. All right.
No. No. No.
All right.
No. No. No.
Very good. All right. So next we're going to test cranial nerves 3, 4, and 6, and that is the 6 cardinal rule or cardinal signs of gaze. So what I'm going to do is I'm going to hold a thin line in front of you, and I want you just to follow it only with your eyes. Do not move your head. Okay. Slight nystagmus noted. Okay, very good. Now I'm going to inspect your eye. I'm going to just kind of pull down on your lids and pull up with your lids just to check your conjunctiva. No lesions, no masses, no bleeding. This sclera is white. There does not appear to be any bleeding or any yellowness. Your irises are a greenish brown color. Check the cornea. No issues with the cornea. Okay, next we're going to check the corneal light reflex. So what I'm going to do is I'm going to shine this and we're going to look at your pupils. This light should appear in both of your pupils in the same spot, okay? And it does. Next, we're going to check your pupils for reaction to the light. So I can see here that your pupils are about 3 millimeters. So once I put the light in, then they should constrict. Very good. Just look at my nose. Very good. All right, now I'm going to check to see the opposite eye. Good. Very good. Okay. So now we're going to do accommodation. So what accommodation means is I want you to look at this wall back here, and I'm going to move this pin light in front of your face. Once I move it in front of your face, I want you to focus on it. I'm going to move it into you, and I'm going to bring it out from you. And that's going to test accommodation. Okay. So just focus on the wall. All right. Now focus on the pin. Very good. All right, so next we're going to do the ophthalmoscope. I'm going to look at the back of the eye to see, to observe the back of the eye. I'm going to come in with the light at a 45-degree angle. I'm going to try to keep your eyelid open so that you don't blink, okay? Very good. Very good. Okay. So I was able to visualize the optic disc, the retina, the macula, and the uvea in both eyes. Okay. So the last thing we're going to do for the eyes is the Snellen test. I'm going to have you hold this little card. It's going to be 13 inches from your face. So I want you to hold it there. All right, I want you to read the bottom line for me.
LTFPH.
All right, now cover one of your eyes.
LTFPH.
All right, and now cover the other eye.
LTFPH.
Okay, all right, so he has 20/20 vision. Next, we're going to move on to the ears. I'm just going to look at the external ear first, and then we'll move from there, okay? So just inspecting the external ear, there does not appear to be any lesions, no redness, no inflammation. Is there any tenderness in the ears?
No.
All right, now I'm going to palpate the mastoid bone. Any tenderness with the mastoid?
No.
Okay. Your external canal. then seen on inspection. So next I'm going to use the otoscope, and I'm going to look into the ear to see if I can find the tympanic membrane. Small amount of cerumen present. There are hairs present. The tympanic membrane in both ears are a pearly gray color, which is normal. There's no drainage, no inflammation, or no redness. Next, we're going to do the whisper test. So what I want you to do is I want you to cover your ear. I'm going to stand beside you. I'm going to whisper a word, and I want you to tell me what I'm saying, okay?
Baseball.
Okay, now cover the other ear.
Hockey.
Okay. All right, now I'm going to turn my back, and I just want you to listen to me, okay?
Pizza.
Very good. Okay. All right, now we're going to do another test for the hearing. It's called the Weber test. I will be using the tuning fork. So what I'm going to do is I'm going to place it on top of the head, and I want you to tell me where you hear the sound, okay?
I hear it.
Both ears?
Yes.
Okay, very good. That is a normal sign. The last thing we're going to do for your hearing is going to be the Rhine test. What I'm going to do is I'm going to hit the tuning fork. I'm going to place it on the back of your mastoid bone, and I want you to tell me when you stop hearing the sound, okay?
I hear it.
You hear it now?
I hear it.
Okay, very good. That's a normal finding.
I hear it.
I hear it now. All right, very good. That's normal finding. All right, now we're going to move on to the nose. So we're just going to look at the nose. There's no redness, no lesions noted. It is symmetrical on the face. What I want you to do is I want you to close one nair off and breathe in and out for me. All right, now close the other nair off and breathe in and out for me. All right, now we're going to do the smell test, which is a cranial nerve 1. I'm just going to have you smell this, and I want you to tell me what it is, okay?
Peanut butter.
Very good. All right. So now I'm just going to visualize up into the nasal cavity with the pen light, just to make sure that there's nothing that we need to address. It's clear. There is hair present. There is no drainage. There is no redness, no inflammation, no lesions noted. Next, we're going to move on to the mouth. So I'm going to assess first your lips, and then I'm going to look inside the mouth, okay? So what I want you to do, I'm just going to look at your lips. There's no cracking. Lips are not dry. They are pink. They are normal in color. Now I want you to open your mouth wide for me. Okay, I'm just going to look around. No redness noted in the mucosa. Under the tongue. Gums appear normal. Okay, now stick out your tongue for me. All right, now I want you to say ah.
Ah.
Okay, the uvea moves the way it's supposed to. All right, next we're going to move on to the neck. The neck is symmetrical. There does not appear to be any masses noted. There are no abnormal pulsations. We're going to inspect the thyroid now. Just looking at the thyroid, there does not appear to be any nodules, no asymmetry. Tip your head back just a little bit and swallow for me. Okay. No evidence of any nodules or swelling. So what I want you to do is just turn your body a little bit for me. I'm going to palpate the thyroid now, and how I'm going to do that is I'm going to come behind you. It's going to kind of feel like I'm choking you, but I'm just going to palpate the thyroid, okay? Any tenderness?
No.
Swallow for me. All right, very good. All right. No masses, no nodules noted. Check for jugular vein distension. Just looking, kind of turn your head a little bit. Okay, no evidence of jugular vein distension. Now we're going to look for the carotids. First, I'm going to listen to your carotids to make sure that there's no bruit. I will use the bell of my stethoscope to do that. Look up for me. Hold your breath. All right, you can breathe. Hold your breath. No bruise noted. Okay, now I'm going to palpate the carotid. We're going to do one at a time. Carotid pulses are equal on both sides. All right, now I'm just going to palpate the trachea, just to make sure that there's no deviation. Trachea is in the center of the neck, and there is no deviation noted. Now we're going to do range of motion of the neck. I want you to flex down. I want you to extend back. I want you to go to your ear. I want you to go to the other ear, and then I want you to turn side to side. Okay. Now what I want you to do is we're going to test the strength of your neck. So what I'm going to do is I'm going to put my hand on the side of your head, and I want you to try to push against my hand, okay? Push down against my hand. All right, very good. Other side. Very good. Okay. So now we're going to move on to the chest and the lungs. Okay. First, I'm just going to look at configuration of the chest. Just breathe normal for me. Chest appears to be symmetrical. There is no evidence of abnormal pulsations, no evidence of lesions. Hair distribution is normal. Just breathe that out for me. He expands on both sides equally, unlabored. Now we're going to measure AP lateral. So what we do here, I'm going to measure from front to back and then from side to side, okay? So I'm just going to kind of put my hands this way. And that's about right. It's about a 2-to-1 ratio. All right. Next, we're going to test for tactile frivolous. So what I'm going to do, so for the camera, I want you to turn your body towards the wall this way. So I'm going to place my hand on your back, and every time I place my hand down, I want you to say 99, okay?
99, 99, 99, 99, 99, 99.
Okay, we'll just stay that away. There was no evidence of extra vibration. The tactile frivolous was negative. Now I'm just going to inspect the back. Going to palpate the spine. Any areas of tenderness?
No.
No masses noted. All right, so now I'm going to percuss your back. And what I'm going to do is it's just going to be a tapping sensation that you're going to feel on your back, okay? Very good. So now I'm going to listen to the back. I want you to take slow, deep breath in and out through your mouth, okay? Now we're going to test for egophony. What I'm going to do is I'm going to lay my stethoscope onto your back, and I want you to say the letter E.
E.
Say it again.
E.
Okay, and I hear E. I do not hear A, so there is no area of consolidation. All right, next I want you to turn around. I want you to lay down in the bed for me. I'm going to percuss the anterior chest. Okay. And then we're going to listen to the chest. Slow, deep breaths in and out through your mouth for me, okay? Lungs are clear bilaterally, no evidence of crackles, and no wheezes noted. Next, we're going to move on to the heart. Since I've already got you laying down, we're just going to stay this way. First, I'm going to check for any abnormal palpitations in the neck, for the carotids and the jugular veins. So what I'm going to get you to do is just turn your head to the side. Nothing noted. Okay, turn your head to the other side. All right, nothing noted. All right, next we're going to test for the precordium. So what I'm going to do is I'm going to put the palm of my hand over your chest in several different areas, and what I'm going to feel is for the vibration, okay? All right, next I'm going to use my fingers to palpate the pulsation, okay? Next, we're going to find your PMI. The way that you find your PMI is we're going to start at the mid-clavicular line, and it should be at your fifth intercostal space. So we're going to come over to the second intercostal space here. We're going to come over mid-clavicular. It's going to be right in the middle, and we're going to work our way down. Third, fourth, fifth. So it should be right here. And listen to it. Rhythm is normal and regular, and the rate is about 63. All right, next we're going to auscultate all of the heart sounds. We'll start with the aortic, okay? We're going to listen with both sides of the stethoscope. We're going to do the diaphragm and the bell, so we'll be doing 2 different times. I just want you to breathe normal for me. Okay. Aortic, second intercostal. Pulmonic on the right side, second intercostal. Throat's point, third intercostal. Tricuspid, fourth intercostal. And mitral, fifth intercostal. Very good. All right, now I'm going to listen with the bell. I'm going to have you turn to your left side so that I can listen to the tricuspid and the mitral valve a little bit better. All right, very good. I'll have you lay back on your back. Everything was normal. I heard the S1, the S2, where I was supposed to. There was no evidence of murmur. There were no evidence of a split S1 or S2. No evidence of S3 or S4 noted. Next, we're going to percuss the borders of the heart. So we will start third intercostal space. We'll start laterally. We will percuss over. We will go down to fourth intercostal space. We'll percuss until we hear dullness. And then we'll go fifth intercostal space. Right there. Okay, so that's percussing the borders. Next, we're going to move on to the upper extremities. Okay, I'm going to have you sit up on the side of the bed for me. Just let your arms hang. For inspection, the shoulders are equal in level. The arms are normal in size, well defined. We're going to, let me see your hands. All right. Does not appear to be any lesions, any areas here. The nails, there's no clubbing. Capillary refill is less than a second. No clubbing noted. Capillary refills are less than a second. All right, so now I'm going to check your radial and your brachial pulses. So, okay, positive. Now we're going to do range of motion. Okay, so first we're going to do range of motion of the shoulders. I want you to abduct. I want you to adduct. I want you to over the head. And then I want you to go behind your back, all the way back, as far as you can. Okay. So then I want you to cross behind your back. I want you to cross behind your neck. Internal and external rotation. Next, we're going to do the elbow. I just want you to flex it in, extend it out. Okay. And then we're going to do the wrist and the fingers. Okay. So I want you just to drop them down. I want you to lift them up. I want you to make me fists. I want you to open your hands up now. Now spread the fingers wide. Close them together. Cross your fingers over. Very good. Now we're going to check the strength of the arms, of the shoulders. So I want you to push against me. Okay. No, lift the arm up.
Oh.
Okay. Lift the arm up. All right. Very good. All right. Now put your hands this way, your arms this way. I want you to try to pull against yourself. All right. Now I want you to push against me. All right. Very good. Now I want you to grip your hands. All right. Now I want you to grip my fingers. Okay. All right. Now with your wrist, put your wrist up. All right. I want you to push against my hands. All right. I want you to push down against my hands. Okay. Very good. So now we're going to test to make sure that you don't have carpal tunnel. The first test we're going to do is the tie needle. And what I'm going to do is I'm going to have you place your palms this way, and I'm just going to kind of tap on the inside of your index finger to your wrist, okay? And you tell me if you start feeling any numbness or tingling. Okay? Okay? So next what I want you to do is take your wrist and hold them this way, down. Okay? Now press against them. Hold them that way for just a few seconds. Any numbness or tingling? Okay, all right, very good. All right, next we're going to move on to the abdomen. I'm going to have you lay back for this again. We're going to inspect the abdomen. Do not notice any visual masses, no abnormal pulsations. Next, we're going to listen to the bowel sounds. All right, bowel sounds times 4 quads. And with the bell, we're going to listen over the aorta. Renal artery would be from the elbow over. Renal artery, elbow over. And then the iliac. And the femoral. All right, next we're going to percuss the abdomen. It's going to be 9 different areas of the abdomen that are going to percuss, okay? Okay, it's all normal, resonant sound. Next, we're going to move on to percussing the borders of the liver. So you would go midclavicular line, start right below the nipple. And you would percuss until you hear dullness. All right, and then you will move up from the umbilicus. All right. Sorry. And this is the borders here. Sorry about that. Okay. Next, we're going to percuss or try to percuss the spleen. We should not be able to see this or to hear any sounds of the spleen, but you would start. Sorry, you would start below here, and you would percuss over. It's going to be right underneath the rib area. There is no evidence of dullness in this area, so he does not have splenomegaly. All right, so next we're going to palpate the abdomen. We're going to start first with a light palpation, and then we'll move into a deeper palpation. Any tenderness? All right, a little bit deeper. Any tenderness? No tenderness, no mass is noted. All right, next we're going to palpate the liver. What I'll do push up, put your hand under your back here. We're going to push up and see if we can palpate. Good. Next, we're going to try to palpate the spleen. Put the hand behind the back. No, you just lay flat.
Okay.
You lay flat. All right. Do not palpate the spleen. Next, we're going to try to palpate the kidneys. Same way, we're going to put the hand behind the back, just stay flat, and then we're going to try to remove from the umbilicus out in the end to see if we can't get the kidney, okay? Cannot palpate the kidney. Next, we're going to test for the different signs for appendicitis. There are several different ones. First being McBurney's, and that is you would press down diagonal from the umbilicus. Is there any pain here?
No.
Okay. All right. Next, we've got the Rosford, and what that is you would palpate on the opposite side. And if there's any pain noted, then that would be a positive Rosford. Okay?
No.
Okay, very good. Next, we're going to do the psoas, and that is just extending the right leg out. It's extended out. Is there any pain noted?
No.
Okay, all right. Next, we're going to do the obturator, and that is going to be rotating the leg. So I want you to take it, put your heel here on your knee. No, the other one. Take this heel, put it on that knee, just prop it up. Very good. Yep, very good. All right, so then we're going to just rotate it in. Any pain? Okay, very good. All right, so you can drop this leg now. Next, we're going to assess for ascites. There's no evidence of ascites, but if there were abdominal fullness that we would notice, then we could percuss for dullness over the abdomen. You could also do the wave test, where you would tap one side of the abdomen and see if there was any wave of fluid that would pass over. Next, we will test for cholecystitis, and the way that I'm going to do that is I'm going to press up onto the area where the liver is, and I want you to take a deep breath in for me and let me know if you feel any pain, okay? All right, deep breath in. Any pain? Okay, very good. It's negative. All right, so now we're going to test for CVA tenderness. So we would test this if we were having any urinary symptoms. I want you to sit up on the side of the bed for me again and kind of turn to the side. You don't have to hit hard, you just barely tap. Any CVA tenderness?
No.
Okay, very good. All right, so that is negative also. Now we're going to move on to the lower extremities. So first we're just going to look at the lower extremities. Everything appears to be normal. The hair is distributed. There's no discoloration. There's no evidence of any darkening with the lower part of the leg that would indicate arterial insufficiency. Check the temperature of the leg. Appears to be good. We're going to check the turgor. Sorry, turgor is immediate. Okay, so now we're going to check the pulses. The femoral, we're just going to say that we have checked the femoral. They're in the bends of their growing here. Next, we're going to check the popliteal. Just let your legs hang. Okay. And now we're going to do a posterior tibialis. And then the dorsal piece. Okay. All right, we're going to do your hip range of motion now. I'm going to get you to lay back in the bed. Because of space, we're only going to be able to do the one leg, but you would repeat this on the opposite leg. So what I want you to do is I want you just to bend your knee for me. All right, and we're going to bend all the way back. We're going to extend all the way out. All right, and now we're going to abduct, and we're going to adduct. Cross it over. Very good. All right, you can relax it down. Now I want you to take your knee and put your heel and put it on this knee over here. All right, and we're going to externally rotate and internally rotate. Any pain or tenderness? Very good. Okay, that's full range of motion of the hip. We're going to go ahead and test strength of the hip. So what I want you to do is just push out against my hand. Very good. All right, so I want you to sit up on the side of the bed again for me. So with the knees, I just want you to extend both knees out and then flex them down. All right. The ankles, I want you to pull up. I want you to push down. All right, now we're going to test strength of the legs and of the ankles and the feet, okay? So I want you to push up for me, and I want you to pull down for me. Very good, all right. I want you to push up for me, and I want you to push down for me. All right, very good. I want you to curl your toes. I want you to uncurl your toes. I want you to spread your toes. Okay, all righty. Next, we're going to do the neuro check. First thing that we're going to do is I want you to close your eyes. I want you to put your hands out to the side, straight out, okay? Now I want you to take your fingertip and bring it to your nose. All right, now do the other side. Very good, okay. Now you can drop your arms down, you can open your eyes. Now we're going to do the fingertip, or the other cerebellar test, which is the rapid alternating. And what I want you to do is just place your palms in your hand or your lap and just flip them fast as you can. Very good, very good. All right, the other test I need to do for the cerebellar, I want you to take, and I want you to just take your heel and slide it down your shin on both sides. All right, very good, okay. Next, what I'm going to do is I'm going to take your hands, and what I'm going to do is I'm going to pull one of your fingers up or down, and I want you to close your eyes, and I want you to tell me if I'm pulling your finger up or if I'm pulling it down.
Down. Up. Up. Down.
Okay, while I've got your hands here, I forgot to do this earlier. The temperature is normal. The turgor is good. Okay.
down, down, up.
And trigger is good on this hand also. Okay. All right. So next, what we're going to do is the sensitivity and the pain for the neuro check on your around your arms and legs. So first, I'm just going to do your arms and your hands, and then I'll do your legs and your feet. Okay. I want you to tell me when you feel it. Close your eyes.
I feel it. I feel it. I feel it. I feel it. I feel it.
All right. Now we're going to do the pain.
I feel it. 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 I feel it.
All right. Now we're going to move on to your legs. Just close your eyes for me.
I feel it. 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 I feel it.
Okay. And now we're going to move on to the pain.
I feel it. 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 I feel it.
All right, very good. Now we're going to move on to the reflexes. Several reflexes that we're going to do. A couple in the arms, a couple in the legs. Okay. So first, what I'm going to do, I'm just going to hold your arm out. All right. This is the brachial. All right. Now I want you just to hold your arm out. Just relax it into my arm. This is the tricep. All right. And then we're going to do the brachioradialis. You can feel it moving under my hand. All right, very good. Now we're going to move over to the patella. Just let your legs hang down for me. All right, and then we're going to do the Achilles. Hold your foot. All right. And the last system that we will cover is the musculoskeletal. Once again, I'm just going to look at your back. We're going to palpate your spine. I'm going to have you stand to do this because there's a couple of things I'm going to need you to do for me here. Just turn your back towards the camera there. Perfect. All right. So we're just going to inspect the spine. Any tenderness?
No.
All right. So now what I want you to do is I want you to bend over. Bend over and touch your toes. Okay. Spine seems to be straight. No evidence of curvature. Now I want you to just try to extend back against my hand a little bit. Just straight back that
straight
way.
back.
Yep, that way. All right. Perfect. All right. Then I want you to take and bend to your side this way. Put your hand down. Very good. And now bend the other way. Okay. All right. And then I want you to just walk, turn around and walk towards the camera for me. Okay, normal walk. Okay, now come back and stand in front of me. I want you to turn and look at me. I want you to stand up on your tiptoes. All right, now I want you to come back over here and stand, and I want you to walk on your heels. All right, and now come back. And the last test that we're going to do is going to be the Romberg test. I want you to turn towards the camera here. I want you to close your eyes. I want you to put your feet together. Let your hands hang down. That's a negative Romberg test. There is no drifting. There is no swaying to the side. Okay, you can have a seat. Thank you so much for participating in my assessment today, and that concludes it. Thank you.